people. I'd like to introduce you in person now to another one of those. We've been here, as I said, in Tearfund, South Sudan's compound all week. And so I'd like you to introduce to you Erickson, who's the country director here for Tearfund. He's a very tall man. I'm a very short man, so we're going to be going up and down like that. But welcome here, Erickson.
Thank you very much, Andy.
Tell us a little bit about the work of Tearfund here in South Sudan. What is it that you do, and how do you make a difference in the world?
Yeah, thanks a lot. First and foremost, it's a great pleasure to host you at our office in Juba. So Tearfund provides both life-saving and also resilience kind of services to vulnerable communities across South Sudan. We are present in 5 out of 10 states in South Sudan. So we work with a number of donors, supporters across 5 continents. And we're very grateful for the support that CFGB and Canadian people are basically providing to ensure that we deliver aid to those that need it the most. So Tearfund provides life-saving services to people affected by both conflict and also natural disasters like flooding and other kind of types of issues. So we provide clean water to these people. We also provide hygiene and sanitation services to them. For instance, this year, one donor has supported rehabilitating 68 boreholes.
Oh, wow.
That benefited.
And water is life here, isn't it?
Yeah,
so that's
water
so important.
is life. Yeah, that benefited 35,000 people. We also provide primary health care services. We run health facilities through our local partners. And in the last couple of months, cholera outbreak has basically, affected so many people. We have seen people losing their lives. So Tearfund is there at the forefront with local partners to be able to provide these services. We also provide food security and livelihoods.
And actually, let me just ask you a little bit about that, if I may, because we've been up in the refugee camp in Well East. We flew up there this week. We spent 3 days there. We visited some of the participants on the projects that you've run there. Tell me a little bit about that food assistance you do, but more than that, tell me about what it's like for the refugees in that camp.
Yeah, in Awil, like other parts of the country, we are really working with the communities, local leaders to be able to support these communities fleeing the conflict in Sudan to be able to seek safety in South Sudan. So we are working with CFGB through Tearfund Canada to be able to provide food to these people so that they can basically thrive in this difficult period. We are also planning to start a project, food security project that is supported through Tearfund Canada CFGB partnership, that will see some communities in Awil basically get facilitated to put food on the table without any external assistance.
And we met some of the refugees there. Tell me a little bit about their life, what it's like for them, as much as you're able to. We're going to actually hear from some in a minute on a video, but from your perspective, because it was pretty harrowing, I've got to be honest, in what I saw there.
It's very hard. These refugees have gone through a lot, fleeing the conflict in Sudan. Here in South Sudan, we are talking about slightly more than 1 million people who have basically fled the conflict in Sudan. And these people basically crossed the border without literally nothing. So they need food, they need shelter, they need their basic needs to be met, including clean water and also safety. So we have seen communities basically extending support to them even before international humanitarian organizations reach them. And we are also leveraging in our partnership with churches in South Sudan to be able to support these villages.
It's actually interesting you should say that, because we visited a village yesterday, and that village was hosting returnees, so not refugees who come from Sudan, but people who've gone from South Sudan because of some of the issues here, settled in Sudan and are now coming back because of the war that's in Sudan. And one of the things that I found absolutely fascinating was that we were meeting people who had nothing. I mean, literally nothing. They've been food assistance recipients themselves, but they were actually hosting people who came back with nothing themselves. Why do they do that? What is it about the community that makes someone say, I have nothing, but come into my house? I've never met you, but come into and be part of my family.
Man, that's out of humanity or human.
Right.
You know, even as part of the African culture, when you have a visitor, you have to basically extend support. So we have seen that happening in South Sudan, where, you know, the host community basically provide the little support they have to these refugees and returnees. So it's a good thing, and
it's a great thing.
Keep encouraging it, and even the church to also take the lead in responding to those needs and support these communities.
And just one final question. I mean, we heard from Duke just now about some of the difficulties that the cuts to USAID has caused. When we talked privately just a couple of days ago, you were telling me some of the things that it's meaning. You were talking about your malnutrition program, your childhood nutrition programs being cut. What's going to be the impact of this? And it's not just USAID, it's other countries as well. What is the impact of taking that life-saving aid away from a place like South Sudan?
Before tackling that question, I would just want our viewers to be able to understand that the humanitarian context in South Sudan is dire, very dire, and funding has been shrinking over the last couple of years. In as far as the USAID funding is concerned, it's supporting 7 health facilities, plus about 27 nutrition sites across 4.
And this would be for children and mothers.
For children and breastfeeding mothers. And those pregnant mothers as well who come to seek nutrition support. So it means these 7 health facilities, 27 nutrition sites will not be there anymore. So
and what does that mean? I mean, let's just be honest about this.
Losing lives. So people basically die. And we are in a very difficult situation where we are supporting patients in our hospitals to recover from cholera outbreak in this country. So far, we have lost 38 lives in our basically 7 clinics across Jonglei State. So we're basically calling for support. We have our partner Tearfund Canada, who is also doing their level-based basically to be able to work with CFTB and other donors and the community in Canada to be able to support our work in South Sudan.
I will ask one. I said that was my final question. I want to ask you something else. I've so enjoyed meeting you this week, and I've just loved meeting your team and the atmosphere you have here. How do you do it? How do you keep going on? I mean, we're talking about deaths. I know that you go and you see things. This must be incredibly distressing at times. How do you carry on, Duke?
Yeah, it is indeed. Even the heat wave in the night, I think
I don't think we told people how hot it is here.
Yeah, it's very hot. The temperature varies from 40 to 45 degrees. It's really very difficult. I mean, it's just because it's just beyond work. It's a calling to basically do our part in saving lives, and we can't do it without CFTB. We can't do it without Tearfund Canada. We can't do it without Canadian taxpayers who are basically giving money to support these communities. So we believe our role is very limited, and we are also very grateful to basically, see you coming to visit those.
I feel very humbled by that.
Yeah,
I know who does the real work here, and I'm just so grateful to you and for your team for hosting us this week. You've been absolutely phenomenal, but seeing the work you do is incredible. So thank you so much, my friend.
Much, Andy.
It's been a joy. Thank you.
Thank you very much.